Good day, everyone. My name is Debraj Shome, and we run a chain of clinics called the Aesthetic Clinics, which are in 10 plus cities in India now. Today, I will be speaking on botulinum toxin injections, the where, the how, and the why. Some disclosures are necessary. I have been a faculty and a trainer with the Allergan Medical Institute for Asia Pacific. This is the company which makes the botulinum toxin. I have also been a trainer with 2 other related companies for the past decade. Botulinum toxin is now utilized in over 28 plus indications all across the body, but the first uses were as follows.
प्रवीण भाई डॉक्टर शू कैसे बोलो। जो टाइम पे बात करता है ना उस टाइम पे थोड़ा ज़्यादा बंद हो जाता है।
So in patients who have blepharospasm or hemifacial spasm, 2 conditions in which the eyelids continuously end up closing by themselves, it can become a huge problem. So from that perspective, it becomes very important to treat these patients appropriately, and that is where botulinum toxin first started getting used. So spasm-like conditions, botulinum toxin started getting used first, and that led to the spasm disappearing. But we also realized that this was removing the wrinkles around the eyes and around the forehead, which in turn led to botulinum toxin being used for facial aesthetics, which in turn started off a new concept completely of facial aesthetics and looking younger using Botox.
Hemifacial spasm is a nervous system disorder in which the muscles of one side of the face twitch involuntarily. As you can see in this patient, that her left side of facial muscles are constantly involuntarily twitching. This can, if not treated, lead to the complete closure of the eye and also can affect mentally, psychologically, and even in social settings of the patient. The initial symptoms of the hemifacial spasm can range from frequent eyelid blinking leading to closure of the complete eye and redness and irritation of the eye, dry eyes, and even involuntary constant muscle twitching. The causes of hemifacial spasm can vary from being a vascular compression, facial nerve compression by a mass, brainstem lesions such as stroke or multiple sclerosis, and it could be secondary to trauma or Bell's palsy. The treatment options include microvascular decompression, which relieves pressure on the facial nerve, injections of the botulinum toxin into the affected area, or drug therapy. The surgical treatment has potential side effects, whereas the drug therapy is not much effective. Hence, the botulinum toxin injections in the affected muscles work well and give relief with almost no side effects. It is an in-office procedure and can be done in 30 minutes. Here, as we can see, there are different marking points for benign essential blepharospasm and for hemifacial spasm, which is a more complex disease. Now, in benign essential blepharospasm, as we can see that it is always bilateral involvement and leading to constant eyelid muscle twitching. The B stands for 4 units of Botox, and in the upper part of the eyelid and or over the forehead, total 4 units at each of these points is given, whereas in the lower part of the eyelid or the lower eyelid, 2 units each is given. In hemifacial spasm, muscles of the half side of the face are involved and hence more points of Botox injection or botulinum toxin injection are needed. As we can see here that the forehead point, that is the glabellar point, the eyelid muscle points, even the nasolabial fold, the corner of the mouth, the chin and the mid part of the cheek are injected with 2 units of Botox or the botulinum toxin. Let's see the demonstration on the patient with the injection of the botulinum toxin. As you can see in this, there is immediate relief of some of the symptoms of constant muscle twitching of eye muscles as well as the nasolabial twitching and even the corner of the mouth. Thus, the botulinum toxin injections in benign essential blepharospasm and hemifacial spasms proves to be safe and effective for relieving the patient of the discomfort and providing a better quality of life.
So in general, as we understood, blepharospasm and hemifacial spasm is where botulinum toxin started getting used. And then we moved on to using this for removing lines. Now, some things need to be understood for using the botulinum toxin in facial aesthetics. One thing to remember is that a lot of specialties, including ophthalmology, ENT, oromaxillofacial surgery, dermatology, and plastic surgery, are now into facial aesthetics. And in fact, if you look at the American Board of Facial Cosmetic Surgery, ophthalmologists form a large number of them, those who have completed a primary ophthalmology residency, and as many as 40% of the American Board of Facial Cosmetic Surgery diplomates come from an ophthalmology background. So understanding facial aesthetics becomes very important for these residents. Now, facial aging is basically mother gravity being ever so kind and mother gravity pulling us all downwards and medially all the time. And that's basically what is aging. Then anti-aging must be moving the same facial tissues upwards and laterally. Now, we performed India's first aging trial a couple of years ago, and it's really something that we weren't proud of in the sense that India did not have any data on how Indian faces were aging. So in India, facial aesthetics involved treating Indian patients based on how Caucasian data was coming up. Now that doesn't work. So as a result of which we conducted India's first aging trial. And if it was a photographic documented study, and if you look at this, you can clearly see how Indians tend to age, how this lady has aged from 23 to 37 to 71, and then how she's aged at age 76. Similarly, this lady going from 20 to 34 to 45, and then at age 51, and then this gentleman 40, 75, 86, etc., or this lady at 28, 40, and 49. Basically, the upper thirds of the face ages very well. It is really the mid face and the lower face which are problem areas. And if we remember clearly, botulinum toxin for facial aesthetics is mainly used in the upper third of the face, involving the periocular areas on the forehead. And therefore, Indian faces are more thread and filler faces, which are used to treat the mid face and the lower face problems, rather than botulinum toxin cases, which are used to treat the upper face. Because we don't have, because of the melanin in our skin, we don't have as much facial aging in the upper third as many of the Caucasian races do. However, it's still worthwhile to really understand how Botox works. And the periorbital features are actually the most important. What happens is, because this part is blinking the most and the under eye skin is also the thinnest skin in the body, this undergoes more aging than other parts of the face. And especially in a mask-driven world, this is the part of the face which is also most seen by others. Therefore, it makes sense to treat this part and to make the face look younger and more rejuvenated. Now, there are many reasons for aging, but basically evaluating the aging, figuring out how to treat the patient becomes very, very critically important. So we evaluate the face and then decide the next steps before moving into the treatment. So this is a very detailed presentation. It really talks about facial aesthetics in general. I don't think we have the time for this, but in general, before using botulinum toxin, a medical history, assessment, etc. becomes very important. And that is when you'll be able to understand why the patient is aging the way they are, what their motivations are, and how we can treat them better. Taking an informed consent is extremely important. In fact, the first things that we do is to make sure that we take an informed consent, we take good quality photographs so that there can be documentation which allows us to evaluate how the patient did post the treatment. Understanding the anatomy of the upper face is the most important. Like I said, the under eye skin is the thinnest skin of the human body and therefore shows the earliest signs of aging, also because it continually goes ahead and blinks. And understanding the muscles like the frontalis, the procerus, the corrugators, and the orbicularis becomes very, very critically important as well. In general, the orbicularis oculi is the muscle which is responsible for closing the eyes. It's made up of four basic different parts of the muscle. And they are also responsible for the crow's feet, which a lot of people get at the side of their eyes when they're smiling. Treating the crow's feet is very, very simple indeed. And basically, we have to relax the orbicularis, paralyze is the long word, such that the dynamic crow's feet become less visible when the person is smiling. These are the muscles. The procerus and the corrugators are always injected together. They are brow depressors. And by reducing the activity of the brow depressors, we can get the brows to go higher, which in turn makes the entire periocular part look much more relaxed and also removes the excess skin which is over the eyelid, which mistakenly some people, even in early patients, remove by blepharoplasty, but actually it's a brow ptosis which is causing that excess skin. The orbicularis oculi and the depressor supercilii are also shown in this particular photograph. Now, the botulinum toxin itself, as we've spoken about, is a 900 kilodalton molecule. It's made up of it's basically a neurotoxin. It goes in and stops or cleaves the acetylcholine, which is in the neuromuscular junctions. And by going ahead and doing so, it chemically denervates the muscles. And in that, therefore, the results last for about 3 months until the muscles and until the nerve endings grow back again and the acetylcholine starts getting released again. Now, there's a certain circle of diffusion of the botulinum toxin. You need to be certain that your injection points are a little bit, approximately about 1 inch away from each other. And there are other things which need to be taken care of as well. There are many types of botulinum toxin. We use the Xeomin, the Botox, the Dysport, all of them very frequently. It's important to remember that each one of them behave differently, and therefore one should not be used for the other blindly. Now, we use this in the face on glabellar lines, crow's feet lines, and also on the forehead lines. And that's how botulinum toxin is injected for the glabellar lines. You might have seen one of the injection points in the earlier video. And that's how it is injected for the crow's feet line. Obviously, you need to be careful because if you involve some other muscle, you can also cause crooked smiles, etc. So it's important to take care of all of these things and have a thorough knowledge of facial anatomy. That's how it is injected in the forehead without going too close to the brow. We stay 2 fingers away from the brow. The idea being that the brow can then be elevated and it does not cause any brow ptosis as such. Now, reconstitution is most important. Reconstitute the botulinum toxin with 0.9% sterile non-preserved saline. And that's what we use. We basically use 2.5 ml of the saline into 100 units of botulinum toxin, which basically gives us 4 units of the Botox per 0.1 ml. We tend to store this in the side, the door of the fridge, and you can actually store this in the door of the fridge for even 6 weeks. As long as the cold chain is maintained, the Botox works exactly the same. There's no problem with that. And we published a paper on that a few years ago. That's how the injection points are decided. And that's the various depths of the injection for the glabellar lines. And that's how the injections are injected. You use the thumb and the forefinger to hold the muscle and then make sure that you go to the appropriate depth. and inject the muscle, clearly understanding where the muscle lies, and therefore, to repeat again, facial anatomy is critically important. That's how the Botox is being injected. And this is for the crow's feet. Again, these are superficial injections because, as you remember, the orbicularis oculi is just below the skin, and you can inject the botulinum toxin easily. Away from the eye is what we recommend in those people who are worried about perforating the eye or getting into the eye and causing other side effects. So on the forehead lines, depending on the forehead lines, we inject the botulinum toxin. It's injected in between the lines, and basically we leave a area above the brow which is not injected, so that we can have the brows going up, because the frontalis is the only elevator of the brows, and instead of going too close and causing brow ptosis. That's also how we can use the grid pattern in injecting the forehead, and that's the forehead being injected. You can see that the marking is done with the pencil before the injections are done, and then the injection is given 1 millimeter away from the marking. You don't want to go through the marking, because that in turn can cause some impregnation of the marking pencil marks below and tattooing of the subdermis. So I want to now talk about some patients. This particular patient came into us, and she complained of eye asymmetry. She had already been to plastic and oculoplastic surgeons and had been suggested ptosis surgery. If you look very carefully at her, you can see that the right side of the face is asymmetrical from the left side of the face. The right eyebrow is higher. The right eye has a little bit of inferior scleral show, which is not there on the left side. All of these changes become worse when she's smiling and the left eye looks much smaller. But the question is, it's a difference of 1 millimeter. I don't think we are good enough surgeons to be able to treat half or 1 millimeter of ptosis predictably in all patients. She's also a model, so as a result of which we need to be more careful. What we did in her was a couple of units of botulinum toxin in the hypertrophic orbicularis oculi, which is just below the inferior lash line. And then we injected a little filler as well. And that's what she looks like immediately after. You can see now when she's smiling, the problem has been sorted. The fillers will last for approximately about 15 to 18 months. The botulinum toxin, on the other hand, will last for 3 to 6 months. But the important thing is, every 3 months also, it's a very small amount which needs to be paid by the patient. And she's very happy not having taken the risk of surgery in that sense. These are the befores and the afters of the same patient. Now, some other patients. This is a patient who is the CEO of a large company, and she first presented to us about 14 years ago. At that time, we only had botulinum toxin. Fillers had not still come into India. Just with the botulinum toxin and one filler which had just come in at that moment, we could transform her from here to here. And that's a massive transformation, as you would tell, and it's possible to create these changes. Botulinum toxin is also something which is used to transform the facial contours. And in people who have very broad faces, one of the major reasons is the masseter muscle, which is at the lower face, is very large. And so using the botulinum toxin makes the muscle smaller, and this can cause semi-permanent results. You can see the befores and the afters in this. And in turn, you can see how the shape of her face has changed. And you would probably say that she's lost many kgs of weight, but actually the truth is only the shape of her face has changed. And that's how it's a sequential benefits that can be seen. These changes that are seen post-botulinum toxin in the masseters used to be an off-label treatment, but our paper 2 years ago has qualified and clarified how this, what needs to be injected, how it needs to be injected, how soon and how often does this need to be given, and leading to semi-permanent results. And this is now being utilized by the company to actually apply for FDA approval for this indication of masseter hypertrophy. In general, the aesthetic clinics has been at the forefront of research, and we've worked on multiple things all over the last few years and have been at the cutting edge of research in aesthetic dermatology, plastic and cosmetic surgery, and found a number of usages of the botulinum toxin, including using it in scars, etc. And various other things as well that we've worked on and hopefully help take science to the next level. We train people a lot, as you can tell from the passion in this presentation, that we love to teach. And facialacademy.org is where you should go to if you want to come for one of our training courses. There are various specialties which come in, including ophthalmologists, plastic surgeons, dermatologists, ENT surgeons, and oral maxillofacial surgeons. And they learn from us. And maybe you want to spend some time in learning how to set up your own facial aesthetics practice. That's a book that we've written. 34 doctors from all over the world have contributed to it. And it's a collection, it's an anthology of heartfelt stories. and it's inspirational. It has been on the Amazon bestseller list for the past 3 years or so. And I request everyone to read it, because especially in these times where we need a little bit of inspiration, this will inspire all the doctors watching this presentation. All in all, I thank you for your kind attention and a patient hearing. If there is anything that you need to reach out to us for, please don't hesitate. And thank you for having me here. And thanks for listening to this presentation.